When we think about a patient who might be fighting both breast cancer and COVID-19, there are a huge number of important things to consider. With chemotherapy, we know we suppress the immune system. How safe might that be in someone who's recovering from COVID, whose pulmonary system, whose immune system might not be normal? We know that surgery is risky in a patient suffering from COVID. We know that COVID patients develop an endotheliopathy that leads to the blood being hypercoagulable. So surgery is extremely dangerous under those circumstances. Last week in The Lancet, we saw a report from 235 hospitals on 1,000 patients who had had surgery and COVID at the same time. 50% of them, an enormous number, suffered major pulmonary complications after surgery. And in cardiac surgery, it was 94% of them that suffered. When these hospitals looked at all patients who lost the battle, who died from COVID, 85% of them had had surgery as part of their COVID journey. So that means that we have to work harder to avoid the operating room in patients who have both cancer and COVID. We have to work harder to choose therapies that will not suppress the immune system.